So it turns out that medicine already has all of the information we need to cure cancer, to prevent heart disease and heart attacks, and to avoid behavioral health issues. We just don't have that data organized like we need it. It also turns out that the modern medicine has advanced at a clip that has been hindered by our inability to work with information as many other industries have done. Imagine a time in the travel industry where you had to call someone on the phone to get a plane ticket, or when you had to physically get in your car and drive down to a location to have someone book a ticket for you, or where you had to go into the bank to make a transaction occur. Healthcare has only recently moved beyond that frame of mind, and in many cases still remains in a situation where a person must be present to get the care, and in many cases people are still carrying around paper copies of their record from one place to another. The reason I say that the answer is already probably in the data that we have in healthcare is about 20 to 30 years ago, the data began to become electronic in healthcare in a more systematic way. We began to have electronic health records. These were primarily built for billing and for charging people for healthcare services and getting paid, but now they've begun to shift into the realm of gathering the actual clinical outcomes in order to calculate results and to improve the care that patients receive. However, there's some important facts to understand about information and what generates new knowledge and our ability to improve ultimately the human condition by discovering new things about science that we can apply to medicine. And the first thing to understand is just how much information there is out there. There are literally exabytes of data. That is billions of rows of data that are already gathered in healthcare today, and many billions more being gathered every day as healthcare is delivered, as patients get sick and enter into various sites of care. And so in that situation, that amount of data is so overwhelming that that it generates so much new knowledge around best practices that if we were to take a medical student or someone in training today, and if they were to learn everything that they were exposed to in healthcare, in medical school, and in residency, and if they were to know that cold and to apply it properly in the practice of medicine, and if they were to read 2 journal articles from the medical literature every night and internalize those and really understand them, within the first year of their having been out of training, they will be 1,200 years behind in the medical literature. So that's the clip at which we're generating new information that needs to be factored into the way we practice. And so that clearly is a major problem we have to deal with if we're going to improve the human condition ultimately. The other thing that is important to understand is that, and the literature shows this clearly as well, that when new discoveries are made, it can take 15 to 17 years for those to get from the published medical literature into the day-to-day practice of only 50% of the providers in the country. And so these two sobering facts really, I think, bring to light the fact that it's not good enough just to have the data, and it's not good enough to derive some conclusions from that data, but we have to take the next step and connect those conclusions from the data into some mechanism that helps us operationalize that helps the providers in healthcare, the decision makers, and more importantly, the patients to make better decisions based on that data and the derived best practices to apply them to their lives to do a better job of taking care of themselves or making decisions in their own health. And I think that this is the opportunity that we have begun to work on in earnest by conceptualizing something called the Learning Health System. The Institute of Medicine published a paper on this in the late 90s, early part of the aughts, and this this paper basically outlined the concept of a learning health system, and it is a fairly simple idea, but the notion is that as data comes into or is generated in healthcare, the delivery of medicine, the decisions we make, all of that data is gathered, That data then is organized and cleaned in such a way that it can be immediately used to derive conclusions. And then once those conclusions are derived, it has a receptor site, so to speak, in the delivery system, so that the way I prescribe medicines the next day or the way I make decisions the very next day or even the next instant changes based on the knowledge generated from that gathered information that is turned into knowledge that is then turned into conclusions. And so, for example, if I see a patient today who I put on a particular medication, and then they come to see me a week later and say they've got a rash now and this medication likely caused it, and we remove the medication and sure enough the rash goes away, that piece of information in and of itself and for that one patient is not too informative. But when I take that piece of data and I document in my system that there's a rash, and that data then goes to that patient's central medical record and maybe across an entire population of patients, the fact that that particular drug caused a rash of a certain type in this patient with a certain race, ethnicity, gender, and disease profile, when that gets aggregated with lots of other patients with that same effect, suddenly we begin to see that at some moment in time that the rate of that event will cross a threshold to say it's happening 20% of the time now, that will alert me, and the next time I go to prescribe that very same drug to a profile to a patient who matches that particular disease profile and demographic profile, I'll be alerted that this is potentially going to cause a problem. And this is the notion of the learning health system, that the data we gather today becomes the knowledge that we use as immediately as possible, and that it has a receptor site for me to take action based on that knowledge. And so the way that we are deploying that in the real world now today is that we have begun to think about the kinds of infrastructure that are necessary to build such a learning health system. And it's not very easy to do. If you can imagine combining the interstate highway program that the U.S. undertook in the 50s and 60s, combine that with getting to the moon and with making the entire banking system electronic, that's essentially what we're trying to do here in healthcare, because the wires that connect all of the various healthcare providers didn't exist until just a few years ago. And the information systems to gather the data are new enough that the users of them complain about them incessantly and say that they're unhelpful to their work, that they slow them down. And so we've got to get those kinks worked out. And then you have the policy and the laws and of course patient privacy, which is a serious issue that has to be dealt with in this regard as well. And then finally you've got the need for a workforce that understands what the difference is between the way I was trained to practice medicine, which was a patient comes to sit before me, I think about and treat that patient one at a time, and I gather the information straight from the patient's mouth or from a physical exam of their body. And instead, we have to shift to a workforce of providers of all types across multiple disciplines who think about and understand that this patient is in the context of many other patients that I take care of, and that their particular story is similar to others and dissimilar from others, and to be able to apply, shockingly, math to the practice of medicine. So we begin to use statistics and probabilities and other things to base our decisions on risk. And this is what has happened in other industries that have literally transformed them, so that now, to come back to the travel industry, the price of tickets for seats changes on a minute-to-minute basis based on availability and other algorithms. What if we could use that for good and turn that into the risk of a patient's having a heart attack or a bad outcome or making a poor decision based on minute-to-minute flow of healthcare information or health information for them or for their families. So that's where we have begun our work. And then we have a project that is began as a community-based effort back in 2008 and 9 here in Oklahoma. And our efforts began with a convening of the community in which we brought stakeholders together, stakeholders in health in general. So we had obviously healthcare providers like doctors and hospitals, and we had those who pay for healthcare like insurance plans and employers ultimately who pay the bill for a lot of healthcare services. But we also had politicians, local elected leaders, and other folks in the community, public health for example, involved. And we sat in a room together, actually in the mayor's office, and we had several speakers who presented to us what was going on in our health, and it was abysmal. We were at or near the bottom of many of the health outcomes for the nation, and of course, even within the United States, we're not near the top of the world in terms of our health outcomes, and so we were near the bottom of middle to bottom in any case. And so that effort began to galvanize the community to work together. And as the community began to come together, we all agreed, we signed a charter that we were going to do an in-depth planning process to create something new that has really never really existed before, which was something that would consist of all of us working together, but no one of us owning it. And we thought a lot about the notion of the tragedy of the commons, in which an 18th century economist basically called out the notion that when everybody grazed their cattle on the commons, any one person who abused it was going to ruin the use of the commons for everyone else. And we took that to heart, and we created an organization, a nonprofit organization, which many kinds of groups, as I described a moment ago, could engage directly with and begin to share information through. Created the privacy and security framework that allowed patients and the organizations contributing data to have confidence that their information would be protected, but also to have confidence that their health would be improved, or the health of their patients would be improved by having this organization in existence. And so this effort, now called the My Health Access Network, has grown to encompass the entire state of Oklahoma and has about 3.6 million patients data in it. So chances are, if you live in Oklahoma, your health care records are available to you wherever you go to seek care. And so in that setting, in that environment, then you're able to go to the emergency room and say to the doctor, hey, I really would like you to pull my full record to make sure you don't prescribe something for me that I'm allergic to or that I've already had, or to do a procedure or an x-ray that I've already had as well. And so that is a very important development here in our community, and one of the things that it has allowed us to do that is well beyond just the technology itself and the sharing of health data to improve the quality of care and reduce costs. It's also built a culture of working together, so that we now have regularly conversations where those who pay for health care and those who deliver health care and even those who receive it come together and decide, how do we intentionally want to move forward as a community to improve health. And I'm happy to say that we've had a number of instances where we have changed the game in health care. One of the things that's a fairly well-known statistic now is a recent study published showed that the healthcare system itself, the thing that's supposed to help people get better, is now the third leading killer of Americans. Behind heart disease and behind cancer, being in a hospital system is the next most dangerous thing you can do as an American. And that's because of the rate of mistakes that are made in healthcare. And one of the things that we have been able to address with this combined community effort around My Health is to create visibility to those things that cause errors, like the patient was prescribed the same medication in 2 different places, or the patient has been exposed to too much radiation because they're small and they've had too many CAT scans, for example. So these are the kinds of things that this effort has done. In addition, we were able to, because of the combined weight of the entire healthcare delivery system, attract a national project from Medicare called the Comprehensive Primary Care Initiative. And in that program, we had a unique and new payment model applied. And that payment model basically rewarded primary care providers, your family doctor, your internal medicine doctor, or your pediatrician, for delivering cost-efficient care for you. That is, rather than saying to you if you had a cough or a runny nose on a Friday night, rather than saying, go to the emergency room, their answer was, call me. Let's take care of that right away. Let's not make you sit up all night with a sick child only to go to the emergency room eventually. Call me, let's call in a medication or get you seen in our clinic. And so that program became a game changer in our community because it began to teach providers to practice in a new way. It brought a new level of folks to the table to deliver care managers and others that patients have begun to become familiar with. And in the end of the day, it saved over $100 million in healthcare costs and improved the quality of care at the same time. So this was a win-win situation, and the providers ultimately benefited by generating more revenue because of their performance. So this was a kind of thing that was unthinkable in our community before, because we lacked both the underpinnings of the technology to exchange the data and to make sure we were delivering care efficiently, and frankly to measure the quality of the care we were delivering. And then and in addition to that, we lacked the collaborative relationships and the knowledge of one another's motivations and the trust in one another that we were going to be working in the best interests of the same thing, that is the patient. And so this project has, I think, grown legs and has become known nationally. It's one of the things that Oklahoma is best known for in healthcare, and is in fact the first time I'm aware of anything being first place in America, in the United States, in anything positive in healthcare as a state. But it also has brought a follow-on project that now is a statewide project of similar magnitude, and it's brought a pretty good reputation to our communities. And so the call to action I would make is to make sure that if you or your loved ones are engaging with the healthcare system, that you know to expect that you ask that your records be available to your provider to make good decisions for you, to avoid the mistakes, to ensure you're getting high quality care, and to make sure that ultimately the service you get is of high quality in the healthcare system.